Welcome back. From Milwaukee County going from high to medium for community COVID-19 levels to festivals not requiring vaccines or a negative COVID test to get in. These are just some of the topics we're going to discuss this afternoon with Dr. Jeff Pothof from UW Health. Doctor, thanks for being with us this afternoon. Let's start with Milwaukee County going from that high to medium level for community transmission of COVID-19. I'm guessing that's good news. Do we have to be careful that we don't spike again?
Yeah, I think it is good news. There's really two things that drive that community rating. One is the number of cases you're seeing in the county per 100,000 residents. But the other thing is healthcare resources. How well are hospitals doing? Do they have staff beds? Are they available for people should they get COVID-19? And improvement in those metrics has resulted in Milwaukee County dropping back into that yellow range. So it's not to say COVID's not out there, but things are a little bit better right now than they were, say, a week ago.
Across the state, I think I was looking yesterday, and I feel like there's 380 or so people in the hospital with COVID-19, down from the peak, which was well over 2,000. Pfizer says they have updated a booster to protect against Omicron. How is that going to help?
Yeah, these companies that manufacture these vaccines, they're trying to really thread the needle. So what you would like to do is you would like to have a vaccine that absolutely covers whatever variant is the most common out there when those boosters are due. But if you develop a vaccine that's too specific for what you think is the right variant, if that variant isn't there, your vaccine may not work at all. So what Pfizer's doing, and Moderna's done some of this too, is they have these hybrid vaccines where they have kind of that general protection that we get that we're used to, but also specifically targeting some of these Omicron subvariants that are causing symptoms, maybe not such severe disease. If we can cover both of those, we could get back to the place where once you're boosted, you could be 80–90% protected against any symptoms at all. That would be great heading into winter.
Speaking of summer, there are a lot of festivals underway right now. A lot of people are gathering across our area. And, last year, SUMMERFEST required either vaccines or the test of a negative test before you went in. This year, there are no such requirements. Do we need to be careful of a potential surge, or because most of these events are outdoors, it's relatively safe?
Yeah, I think a potential surge, a large increase in cases, is a little bit unlikely. But I also think there's a tendency for individuals to think that, because they don't require proof of vaccination, because I don't need a negative test, it must be completely safe to go to SUMMERFEST. And although outdoors is safer, there are people who will be at SUMMERFEST, either knowingly or unknowingly, will have COVID-19. And you have to think to yourself, if I came in contact with someone and, I came down with COVID, would I be okay or not? If you're boosted, immunized, you're pretty good to go. If you've recently had an infection with Omicron, you're probably okay. But if you're elderly, immunocompromised, or maybe you're bringing your child who's not yet vaccinated, I'd probably think twice about whether I'd gather them in a large group of folks where you really don't know the status of the other attendees.
Really quickly before we go, I don't know if you've had a chance to check the latest numbers on children getting the vaccine, which of course opened up recently. How are you feeling about that? Are we moving in the right direction there?
I'd like to see more kids get vaccinated. I think there's a perception that kids don't get as sick, and as a population, they don't. But if you're that parent with your kid in the ICU, at that point, you'd wish for anything that you'd had them vaccinated so that they don't get so sick. I think also making sure that for those under 3 that we can get prescriptions so that those folks can get their vaccines. That's important too, and a lot of health systems are working on that.
All right, Dr. Jeff Pothof with UW Health. We appreciate you, as you always join us on Tuesday afternoons. Thank you so much. And a reminder, you can always find the latest information on the pandemic, including where you can get a booster shot at tmj4.com/coronavirus.